All right, I want to say good day to everyone. If you're new here, welcome. If you're not new here and you're returning, thanks for coming back. But I want to get on here to talk about something I was recently reading. I was finding myself dwelling into my old nursing books, and I'm just really enjoying connecting the dots of my experience as a nurse and what I learned in nursing school, and just kind of looking at a different perspective of it from a different set of eyes. And what I was kind of finding myself looking into is a disease process called atrial fibrillation. So this basically is a heart condition that is very, very common, commonly seen in critical care settings. I work in the ICU, and I pretty much see it a lot. It's not uncommon to see it. However, I found myself going down a rabbit hole when I was reading that it is associated with atrial fibrosis and a loss of muscle mass. So I kind of got stuck on that word fibrous, and I was drawn to the fact that people with high blood pressure, you may see them, if left uncontrolled, develop this heart condition. So I said, okay, let's go down this rabbit hole. Let's see where it leads us. And so I did a little bit more research, and I'm finding if you have uncontrolled high blood pressure, I see the relation, how it leads to this heart condition. Okay. So first off, let me tell you, it is not normal to have atrial fibrillation. It is a heart dysrhythmia. So basically, your heart is made up of four parts. Two chambers at the top and two chambers at the bottom. And they're responsible for circulating blood throughout your body, as well as collecting blood flow that is enriched with oxygen from our lungs. That's another day and another time to talk about but what I want you to remember is that it's made up of four different parts. Atrial fibrillation, another name for the top of the heart, is the atria. They're called the atriums. The bottom is called the ventricles. And the heart starts beating, it starts contracting from the top to the bottom. And that is important to know, because if it beats from the top, it's squeezing blood to the bottom of the heart, both chambers. And one of those chambers at the bottom is responsible for sending blood down against the bottom of the lungs to be able to collect the oxygen and send it back up to the other side of the atrium to be able to send out to the rest of the body. Now, all this is taking place with each contraction. And in order for a contraction to take place, an electrical excitement has to take place first. So with that electrical excitement, it starts at the top of the heart, the atrium. So with the atrium, when it stops at the top of the heart, that's where, good day, that's where it has one side to start that effect. The problem with high blood pressure is it causes, over a long period of time, for the heart to become enlarged, because there's so much pressure on the heart if it's not controlled. So now you're dealing with the heart being stretched, not only to normally contract to give us a heartbeat, but it also is fighting against this pressure. And what happens is that prolonged pressure of having uncontrolled blood pressures for so long, it causes our heart to develop, I'm going to put it in a simple way, and that's why I say I go back to the word fibrosis. And what it does, it causes scar tissues, many scar tissues to form. That becomes a problem because In order for your heart to beat, let's pretend my fingers are the muscles. And it'll beat, it'll expand a little bit. But imagine if it just kind of stays expanded. Now I got to expand a little bit wider to contract because it's now enlarged. This is what I'm seeing when I see the electrical current starting from the top to the bottom. So all four parts have these muscular fibers that is supposed to expand and contract. Your heart is a muscle. And what happens is, if that part is damaged where the electricity originates, we call it the SA node for short, your body tries to fix itself. And sometimes it does more harm than good. So when it tries to fix itself, there's other parts of the atria that can also give off electrical signals. But it goes in panic mode. There will be multiple parts of the heart that will try to do the job of the SA node. And so what you'll find when we look at the EKG, which is a way we monitor the electrical flow of the heart, you'll see extra little wavy forms because the heart is just trying to make sure it continues to beat. And it's doing the right thing, but the problem is now uncoordinated. Remember, the top part of the heart is supposed to beat in coordination down to the ventricles. And because there's multiple areas of electricity starting to initiate a pulse, they all are communicating with the ventricles, the bottom of the heart, at the same time. And the heart can become confused. And that person who is experiencing this may feel like their heart is like beating extra fast. You'll even check their pulse and it's uneven. You don't feel that do beat. You'll even feel it with the pulse to confirm that the rhythm that you're seeing on the monitor isn't just some crazy rhythm. It's a really true rhythm. The problem with atrial fibrillation, and I'll go into this a little bit, is because the heart isn't beating properly and it's not coordinated, the top of the heart can now have risk of forming clots because it's not completely giving a full, complete emptying. It's sort of quivering, which allows the blood to collect at the top. All of it's not flowing properly. And then what'll happen is those same clots are the clots that causes strokes. And it'll shoot up into your system, and that's what puts you at higher risk of strokes if your atrial fibrillation is not diagnosed and you're starting on certain medications to help with that. I am going to do a video on symptoms, treatments for it, because it's a very interesting subject to me. I just want to thank y'all for sharing my day with me. I thank you for coming back. If you have any more questions, leave them down in a comment. I'm interested to know how you think. I try to make this as simple as possible because what I find, especially as an ICU nurse, you know, people come up scared. It's a very serious situation if you make it into the ICU. So I try to simplify it so they can understand what's going on and what's the next step. And it pretty much helps them calm down a lot to know those things. So I have to find myself putting it in a more simplified conversation for them to really understand what's going on. This one's a little bit more to chew on because it's just talking about the relationship of high blood pressure, why having that controlled outpatient non-hospital setting is very important so it doesn't lead to this. There are other reasons why we may get atrial fibrillation. but I definitely wanted to point out the risk of not taking care of your high blood pressure. So if you find anybody who's being stubborn about taking their meds, getting it under control, or not even seeing the doctor, and this video is for you, you know. So hopefully it's not a bashing, it's just an encouragement to take care of yourself, okay? If you find this video helpful, join me again. You can subscribe, like, and share this with someone. Thank y'all. Have a blessed day.